Okay, so just to let you know that we're recording this session right now. I'm Kevin Lachapelle, and I'm the Vice Chair for Education for the department. And with me today is Lily Nguyen from Pediatric ENT, and one of the ENT residents, Marco Mascarella. And both Lily and Marco have been really instrumental in getting this done in really record time with the helps of the infection control people at the Jewish and also our own infection control people at the MUHC. So it's really a concerted effort. What we want to do with this presentation is really stress the importance of healthcare safety. And ideally, what we would like to do is try to make sure that nobody contracts the coronavirus. It's really the most effective means of protecting yourself is applying these principles of personal protection equipment, which we'll go through. And the two things that I think we need to understand is the best way to do that would be to have a buddy system, so have somebody with you when you're putting on the equipment, and having somebody there also, especially there when you're taking off the equipment. Although it sounds very simple, as surgeons, it is not intuitive. We don't do it that way when we take off our scrubs. We just take everything off, and then the gloves off last, and then go wash our hands. Here there's a protocol for that, and it's very important that it be followed, or else you're going to be contaminated. So the other thing I just wanted to make sure that you understood, that this is just part of an ongoing presentation and also ongoing training. So there's going to be a hands-on component, and the way we've decided to start is to start with each division, and we would like to have 2 to 3 people from each division to be the champions of that division. We are going to do the trainer on the practical session, and then those champions will train the internal divisions separately. We would like to try to do that tomorrow on D7, that's at the Glen. I realize that it may not be appropriate, or not appropriate, but practical for everybody, but what I'd like to do is to try to do it on D7. I'll send out a schedule, but basically we would start at 9 o'clock and go per hour down an alphabetical list of each division. So it would be cardiac, general surgery, ortho, plastics, urology, vascular, every hour on the hour from 9 o'clock till 2 o'clock inclusively. So that's what we would like to try to do. And really work on training the champions that will then take it to each division. I'm going to get Marco to get started. Just Lily Nguyen will be running the chat side. So if there is a question as we're going through the presentation, feel free to put it through the chat. We'd like you to get through the presentation first and then ask the questions afterwards. I think we did a dry run of it, and I think it's the most important component. I already see a chat from Kevin Petreka about neurosurgery. Yes, of course, we're going to include neurosurgery. I think first we need to get what we have here, but I'll put it down as well, Kevin, right away.
Just to clarify, yes. Tomorrow's session is only to train the trainers. For everyone who's in the audience, we will be getting to you later. And again, if everyone can turn off their video and audio, please.
We're going to get Marco to start sharing his screen. It's a PowerPoint presentation with video. So you're going to see video on the side of your screen. There's a thumbnail where you can minimize the picture, our video, because if you don't do that, you might miss some of the video. It's on that side of the screen as well. Okay? Okay, Marco, why don't you go ahead and get started?
All right, perfect. Thank you everyone for taking this time. So our mission, as Dr. Lachapelle said, is to keep you safe when evaluating all patients with COVID-19. So just the terms to know quickly. So there's 4 terms that we're going to be mentioning often. It's personal protective equipment, or PPE, and that's all the protective clothing, the masks, the shield to protect you from infection. Obviously, to don is when you put on the protective equipment, and doffing is to remove that protective equipment. Last thing is the aerosol generating medical procedure. So this is any intervention which involves manipulation of the upper aerodigestive tract, and we'll be touching on that at the end of the presentation. The 3 goals of this presentation are to understand the principles of PPE when evaluating a patient with suspected or confirmed COVID-19, to learn the steps to don and to doff, and we'll allow some time for questions, as Dr. Lachapelle said. So just a quick introduction. So obviously we're using these equipment in patients with suspected or confirmed COVID, and obviously the modifications or the changes in policy happen on a regular basis by the MUHC, so that by no means this might be modified in the upcoming days. What's very important is really to have a buddy system, where you have someone else that's checking and balancing, just needing to make sure that you're appropriately covered, you're appropriately dressed before going into the room. Can everyone just mute their mic? Sorry, I'm getting a lot of feedback. To go into the room, as well as when you're getting out of the room, to ensure that there's no self-contamination. And the most important thing is you want to avoid redundant evaluations or procedures to reduce our risk of exposure and that of our healthcare workers as well. Obviously, all personal items, including jewelry, watches, ID badges, your wallet, pens, or phones, are to remain outside of the patient's room at all times. You want to make sure your nails are trimmed, if any long hair is tied, and the beard is shaved. So we're going to be going through some basic PPE. So this is when you're taking a history or physical exam, obviously excluding any examination of the eye, the nose, or the mouth for a patient, or for reassessment of a suspected or confirmed COVID-19 patient. So we're going to start with the donning process. So this is putting on that equipment. So the necessary equipment that you need obviously are gloves, the N95 respirator, a face shield, a gown, alcohol-based sanitizer or soap, and if possible to have a buddy around with you. The first step, which is done outside the patient's room, is washing your hands. And you can't stress it enough, you really have to wash your hands for 30 seconds. You want to wash in between the digits, the back of your hand, your wrist, and you really have to be consistent about this. This is very important to prevent self-contamination. Once you've completed the hand wash, we're going to go on to step 2, which is placing your gown.
Please turn off your audio and video, please, to all newcomers.
So when you're placing your gown, you want to make sure it's covering you from neck to knees. You want to use the yellow disposable gown for low-risk soiling procedures. Now, when you're tying your gown, it might be a bit non-intuitive, but you want to tie your gown that is comfortable around your neck and is covering your part of your neck, but at the same time, that would be easy to remove in the future. So obviously you want to tie at 2 places, both at the upper neck and at the body. And what's important here is you want to make sure your buddy's checking you to make sure you're completely covered from the front as well as from the back end. The next step after this is going to be, is placing the N95 respirator. And you want to ensure you have the correct N95 model. And this is, you have to be fit tested prior to obviously placing an N95. You want to open it fully and cup it in your hands, and then you want to place that over your nose and your mouth. You want to place the upper band first, and then you want to place the lower band. Obviously, these bands can cross, and for those wearing glasses, you got to pay particular attention not to knock them or to get the band stuck behind the frameware. The next step after that is you want to compress with 2 fingers the nasal bridge to allow a good seal. Of course, you want to avoid any pinching, because pinching could make a little leak. The next step after that is you're going to exhale sharply just to check if air is escaping, to make sure you don't have any leak on the front, the sides, as well as underneath the mask. Once that's done, you communicate that with your buddy. The next step is obviously placing a face shield. You want to ensure this covers the entirety of the face, and then this is checked with your buddy system. You're placing the elastic band behind your head, and you're making it appropriately cover the entirety of your face. The next step is the gloves. So obviously you want to have a good overlap between the gown and the glove. One of the options for doing this is called the hole and sleeve technique, and this is to prevent wrist show, as is showing in the video right now. You're going to use a single pair of gloves to cover your wrists. You could also consider having longer sleeve gloves if they are available, such as surgical gloves or whatnot. Once the gloves are on, you want to bend your elbows just to make sure that you have no wrist show. This is something that's very important to prevent self-contamination when you enter the patient's room. The next step is obviously you want to get a check by your buddy, and then you could enter the room and go on with your clinical evaluation of the patient. So just a quick summary of the donning process. So the first step is washing your hands. Then you're going to place your gown. You're going to place the N95 respirator as well as the face shield, and then your gloves. And before going in, you're going to make sure everything is checked, and then you can enter your room. Now we're going to go with the doffing process, or getting this equipment off. So it's important to understand that for the doffing process, it's really after every single step, you have to ensure you wash your hands for 30 seconds. You could use soap or you could use an alcohol-based sanitizer, but you have to do this. It's considered that the front of the gown, the face shield, as well as the N95 respirator are the most contaminated. And that's why when we're doing the doffing process, you want to start from the back and then remove everything towards the front. So the first step is removal of the gloves, and this occurs in the room itself. You want to pinch and remove your glove, and you want to roll it off. What you're going to do with your other hand after is you're going to slip it underneath, and you're going to remove the other glove. And this is the counterintuitive step, really. This is not something that surgeons usually do, and that's why you have to pay particular attention to this. Once you dispose of them in the waste bin, then you're going to go wash your hands immediately. And obviously contamination may occur at this point, and that's why you want to really make sure you wash your hands for 30 seconds. In the video, I'm using water and soap, but you could also use an alcohol-based sanitizer. The next one is the removal of a gown. And of course, this is happening in the room as well. You want to untie the upper part of the gown, and you want to pay particular attention so that your elbows aren't touching your face, because that would be another risk of contamination. Once you're able to untie the upper part of your gown, the next step after that is you want to remove the gown from back to front. And then what you want to do is you could rip it at the lower waistline, and you want to roll it into a ball and dispose of it right away. Once that's done, again, you're going to go back to washing your hands. Can't stress this enough. The next step is the removal of the face shield. This is again removed in the room. So you're going to lean slightly forward and bend over the waste bin, and you're going to remove the elastic band at the back, not at the sides or the front, really at the back, and you're going to dispose of that right into the waste bin, and then after that, you're going to be washing your hands. Of course, the mask is going to be taken off last, but that's taken off outside the room. You want to avoid touching any surfaces in the patient's room. And once you exit the room, you close the door and you wash your hands immediately afterwards. The next step is removing the N95 respirator. And this is done outside the patient's room. You're going to lean forward over a waste bin, remove the lower strap first, and then the upper strap. This is where you have to maintain tension. And it's a tricky procedure actually to do, just to take it off without having it touch all over you or fall somewhere else. Once the mask is removed, then you're going to wash your hands immediately afterwards. Once this is done, then you're ready to proceed with your other clinical duties. So just in summary for the doffing process, you want to remove your gloves, then wash your hands, untie and remove your gown, then wash your hands, remove your face shield, then wash your hands. And at this point, you can exit the patient's room. Once you do so, you get out of the room, you're going to wash your hands again and remove your N95 respirator and wash your hands. Then you're ready to go on with the rest of your day. For aerosol generating medical procedures, so these are procedures involving any manipulation of the upper aerodigestive tract. This can produce significant aerosols and it does require additional protection. And examples of this include nasogastric tube insertion, oral or pharynx examination of the eyes, laryngoscopy, nasopharyngeal swab testing, or intubation or extubation procedures. So the personal protective equipment for aerosol generating procedures we're going to go over next. Now, you have to understand that there is some controversy in terms of the donning and the doffing regarding this, but the overall steps are similar to what I've shown above. However, you have to wear that water-resistant or blue surgical gown, which is mandatory. This is obviously to prevent any gross contamination or soiling of your gown. The other thing that's a bit different is the removal of the gown and gloves. This is performed at the same time and is similar to how surgeons take off their gowns after an OR, where you take them all off at a unit. You keep your gloves on. There's no need to untie the upper part of the gown. And basically you just rip it and you roll the gown off with your gloves together. And once that's all removed, you go and wash your hands. We have to know that there is a lack of consistency regarding the recommendations of surgical hats and shoes. And obviously there's going to be further clarification of this likely in the next few days to understand what are the next steps regarding this. Some additional tips I want to say is it's suggested to wear closed shoes which are easily wipeable, like the plastic or rubber shoes, and avoid those that have holes in the front or the back end. While you're in hospital, ideally you'd want to wear scrubs. You want to clean your glasses regularly with the available wipes. You could consider cleaning your neck and face with the wipes or using soap and water. A good practice point is for those that still haven't gotten fit tested for the N95, a good important thing is to keep it so you could practice removing it and putting it back on, as this sometimes takes a little bit of practice. And of course, if you wear glasses, it could be much more trickier, and practice makes perfect, as it's not always intuitive. Just in some concluding remarks, we want to ensure that someone always checks your PPE placement prior to entering the room. This is really important to make sure you haven't skipped any step. You want to wash your hands after each step of the doffing process, and you want to avoid all redundant procedures or evaluations to minimize your exposure. We've already trained several PPE champions thus far, and obviously this is our contact information. And at the end of the presentation, I've left 2 videos, one of the MUHC PPE, which goes from start to finish, as well as the CDC recommendations for PPE, which are very similar. Thank you.
Okay, so thank you, Marco, for that great presentation. We have 230 people who joined us. That's really great. I wanted to ask if people can enter their questions on the chat, and we will try to address it audio. In terms of many of the questions, we don't have answers to that. For example, usage of N95 masks or access to N95 masks or things like that. What we can do is, if there's a lot of interest on these types of questions, we can try to see what we can do with infection control and try to answer these questions for you. But the goal of today was really just for you to learn how to put on and put off your PPEs. Is there any questions specifically to donning and doffing of equipment? If you can write your questions, we'll be happy to answer.
Lily, can you hear me?
Yeah.
If you start on the chat, because there's already quite a bit, maybe we could just go through them.
Sure.
Maybe you could start with Sheriff Emil about the N95 fitting, and then we could just go over them until we get through them all, if that's okay.
Sure. In terms of N95 fitting, do you mean that it's on hold or not? I don't actually know that information. Do you know, Kevin?
No, I don't know, but I'm going to check.
Okay. In terms of hair or head cover, that is really for aerosolizing aerosolizing generating medical procedures. So you'll see AGMP a lot in the MUHC protocols. So that's anything that enters through the nose or through the mouth where the virus can get aerosolized. So in those cases, such as laryngoscopy, a bronchoscopy, a nasopharyngeal swab, you have to do it in a negative pressure room. You need an N95 mask, you need the blue gown. In terms of head or shoe cover, that is still not clear. There are a lot of protocols out there. We're still in the process of trying to reach infectious diseases and infection control to see in terms of hair, head, and shoe cover for the AGMP process. Don't you contaminate the sink? Yes, it's important when you are removing your gown that you try to not touch anything else. One of the things is when you're taking out your yellow gown, when you put it and you pull it, make sure your hands don't touch your neck. And then when you pull it off, your hands, which should be clean because you just cleaned it, should touch the inside part of your yellow gown and not the front part of your yellow gown. So you pull it off your shoulder, touch the inside part that's clean, and then roll it so that your hands never touch the dirty front of your gown. What do we do with stethoscopes and phones? There's a whole protocol on how to bring in and remove equipment. Ideally, if there's anything that you can leave outside, pens, iPhones, anything like that, please don't bring it into the room. For the stethoscope, I don't know. I'm wondering, maybe infection control has suggestions of keeping a stethoscope designated for that patient inside, but I really don't know.
I think these are questions that we will maybe ask infections control and maybe publish the response.
Yeah. Again, prolonged use of N95 masks, removing them, I don't know either. I don't know in terms of access for dentistry for blue gowns. That would also be through infection control. Can this removal as a unit be done from the previous non-aerosol instead of taking off gloves and untying gown? I'm not sure about this question, if that person can re-type it to clarify the question. We were told not to wear scrubs outside of the OR. Kevin, I don't know if you have any questions about that. Are the links to video and presentation available? Yes, so once this video has been recorded, we will send everyone the link so that they can refer to this again. The email that you got today for the invitation for the Zoom has the presentation included already. So you should have access to the presentation with all the videos already.
In the beginning, we used to live
for the AGMP, yes, you remove the patient in the room and you keep the mask and you remove the mask outside. Is the body a member of the infectious control or someone like me? The body, so the infection, from my understanding, the question is, are the people from infection control from infectious diseases? I'm not quite sure what that question is, if that person can ask, retype their question. What about the antechamber? The antechamber has certain areas that are being set up. My understanding is that the OR and the ER are setting up these antechambers. The antechamber only works if you have a negative pressure room. So if you have a non-negative pressure room, a regular room, my understanding is that there's no point for an antechamber. But again, I'm not an expert on antechamber. Next question, N95 not on hold as of today noon. Okay, so that's great. N95 fitting is not on hold as of today noon. Next question, for eye exams. Yes, so for eye exams, I would think that it would be considered high risk. Currently, it is not part of the list of AGMPs. There might be room for you to talk to infection control and infectious diseases for that. For example, on Sunday in the latest protocol, all dental procedures were newly added to the list of AGMPs. So from an ophthalmology point of view, it might be a good idea to reach out to your infection control group. At the JGH, N95 fitting is currently not available. Agree with the stethoscope. This is from our respirology colleagues in terms of having a designated stethoscope in each room. Why can't we use blue gowns for all cases? It's completely a matter of resources. We do not have enough blue gowns for all cases. Why are we differing from the WHO process? They recommend 2 gloves, don't use bare hands to remove gown. There are many, many protocols out there. Each individual society also has different donning and doffing protocols. So we decided to go only with the MUHC to make it the most consistent. Sorry, there's someone who has an audio on, if that person can turn it off. So this presentation is currently based on the latest MUHC protocols. As things change and develop, we will be sure to update the PowerPoint presentation and send it to you. Having recently intubated a COVID patient, yes, in terms of neck and face masks, right now, infection control feels that the risk of, sorry, can everyone turn off their audio, please? The risk of contaminating ourselves and removing that big headgear is actually very high. But I completely understand the issues. For example, the Canadian Association of Anesthesia does recommend having complete head and neck gear. But currently at the MUHC, my understanding is that they don't advise it because they think the contamination risk is higher.
Lily, can I just comment on that from COSAR? When we were doing it in the operating room, we did come across that question when we were testing it out, and it's clear that it might be an issue. We were talking about actually washing the neck as well when we finished. Now, again, just to make sure people understand, this is for aerosol generating procedures. This is not for what we were talking about, which is non-aerosol generating. The non-aerosol generating, again, just to repeat, is when you're going in to examine a patient, evaluate a patient, look at a patient. It's not a procedure where you're actually going to do, obviously, a high-risk aerosol procedure such as an intubation, which is what COSAR is talking about. But I think we do have questions for infection control with respect to aerosol generating. Obviously, these are the ones that are more concerning. So we will note this one, COSAR, and hopefully we'll be able to get an answer for you.
And if they do suggest having head covers and stuff like that, that requires a specific donning and doffing procedure, we will look into holding another Zoom meeting about that specifically. The next question was about wearing scrubs. So definitely if you wear scrubs after doing an aerosol generating medical procedure, it might be a good idea to change the scrubs. But right now, in terms of MUHC, we don't have any protocols for changing scrubs after every single patient. So in terms for the low soilage situation, we're using yellow gown, removing the gloves and untying the gown by hand. Can we not use the same procedure and remove it as a unit? I'm not understanding this question. So one of the things you can, some people have just kind of flexed and moved their hand forward in order to break the tie in the back. But it's not consistently able that you're able to rip the tie in the back. So if you have to rip the tie in the back, you want to be able to get your gloves off, wash it before you reach back. The problem about pulling things like this as a unit with your glove on is that if you tear the yellow gown, then you have contamination behind your yellow gown onto your scrubs or clothing. So that's why they suggest to remove the glove and then just go straight for the tie in the back and then roll everything and discard. Should surgical masks be used in the hospital where COVID patients are admitted? That we will ask infection control. There is significant shortage. There needs to be appropriate allocation of surgical masks. So for sure, if you're entering a room where the patient is known COVID, yes. But if it's just in that area, currently, from my understanding, no. So an update from the MUHC. They are on hold and prioritizing for N95 fitting. And yes, so the latest MUHC protocol says not to wear an N95 mask for non-AGMP. That is true. Marco, do you think you can comment on that? Because I know you had teaching from infection control, both from the Jewish and from the MUHC, in terms of the use of N95 masks for non-AGMP.
Yeah, so the newest recommendation that the MUHC sent out on March 21st, we all got an email, is obviously COVID suspected or positive patients that are either critically ill, either in the emergency room or in the ICU with fever and respiratory symptoms. Those that were suspecting it with fever, respiratory symptoms, obviously when we're going to be doing a procedure, and those in whom we don't know their status, obviously those with altered level of consciousness or trauma patients, they recommend using an N95 mask. These are I guess the most up to date right now. This might change in the near future, but so just to repeat it, so for critically ill patients having fever, respiratory symptoms, obviously when we're doing a procedure, or for patients where we can't confirm their status either because of trauma or for an altered medical level of consciousness.
Are there yellow gowns that are larger? I don't know, but we can ask if that is a possibility. In terms of situation for trauma activation, so Marco, in terms of trauma activations where there may be intubations, this is would this be a situation where you should be wearing a blue gown?
Yes, exactly. It's also mentioned on the MUHC protocol. So any trauma case that it's either unsuspecting that you don't know the status, or the patient you can't confirm it, then you're going to wear your full gown and a N95 mask and the water resistant or that blue gown.
And then in terms of double glove, I think right now there is also issues with resource management of if everyone were to double glove, we may not have enough. The other thing is if you wear the glove for a long time, in one of our simulations, it becomes very hard to actually remove one glove at a time. So you're supposed to move one glove at a time. When you double glove, sometimes it becomes hard to remove each of them separately. We are now in terms of double glove. Last question. Doesn't seem reasonable to roll a contaminated gown down over clean hands. So you're not supposed to be able to, you're not supposed to contaminate, right? So if your hands, you're touching the inside of a clean gown and then you're rolling it down and then you're just taking it off. So you touch the inside of a clean gown, you roll it down and you take it off. So you shouldn't be touching the front of your gown. If a patient sneezes on you, is that considered aerosolizing? I guess so, but I'm not sure I'm not sure what to do, because by then you should have already decided what donning and doffing equipment you already have. And in terms of the gown rolls over your hand, yes, there is a moment where it has to roll over, and that's why if you can just kind of roll it and at the last minute pull it off. This is what infection control is suggesting, which is why we wash our hands and wrists at every after every single step. When you're doffing your equipment, at every single step you want to wash your hands for 30 seconds, including your wrists, because your wrists are areas of high contamination. Dan, your question about approaching all unknown status trauma as AGMP in our emergency department. I don't know this completely well. I think Marco was saying yes so far, but we can confirm with you in terms of this, because you would be in a high risk situation. So I will confirm with you in terms of, is trauma considered an AGMP in the department? And the same thing with CPR procedures.
So CPR is considered an AGMP.
Okay, there you go. Viral transmission during laparoscopy and surgical smoke. Yes, so I think there's a lot of procedures that you guys need to bring to your OR committee in terms of what is considered an AGMP. For example, the children's, I'm having a meeting tomorrow with my infectious control to expand the list of AGMP in terms of what happens in the operating room. So for the Department of Otolaryngology, I'm trying to advocate for any procedures where you have access through the mouth or the nose should be considered an AGMP. I seem to have come to the end of the question list. Is there any other questions? If not, we're going to be, how and when will we, okay, so in terms of training, again, remember the training for tomorrow is only for the champions of each of your departments. So tomorrow, what we will be doing is training the champions. Then we will send out an email to all of you with their contact information, and you can contact your champion in order to get further training if you wish. So you should be getting an email after a few, hopefully by midweek, the latest. And if we see that this video recording doesn't work well, we will try to do another repeat session later in the week. And if there's a big need for donning and doffing for aerosol generating medical procedures, we will also send follow-up emails for that.
Lily, can I just say a few things? So I am getting some emails from other groups that want to do it. We will do it. We may not be able to get everyone done tomorrow, but we will also put another session in for Wednesday. So by Wednesday, we hope to get everything done. And what we'll do is we'll keep the chat questions. And specifically, I think there are some ones that came up repeatedly, such as the N95 fitting. It seems to be on or it seems to be off. We'll try to clarify that as well. And the other question was how much, I guess, body armor do we need when we're doing aerosol generating procedures or not. So we'll try to get in on that, on an answer on those questions, and maybe publish the answers to the chat widely. Okay, so I think what we'll do is, as Lily said, this is recorded, and so it'll be available to everybody. In addition, you should have received a link both to Marco's presentation and the videos, if you want to look at them again and take a little bit more time to look at the videos and so on. So that's it. I will be sending an email to the PDs as well as to the division directors to start in surgery, and those people that send me an email requesting hands-on training, we'll try to get to you by Wednesday as well.
So I think we're at the end of our session. So thank you, everyone. Thank you, Kevin, for arranging all of this. And please stay safe, everyone.